Hello, I'm Jonathan from the YMCA. Pleasure to have you with us today. I am really grateful to have these opportunities to bring to you experts in their field relative to living a mindful, fulfilling, vibrant life. And today's topic is a very important topic. It's part of the national attention this month, fighting childhood obesity. And I'm fortunate to have our guest, Dr. Kelly Matadel, and her offering her expertise related to this subject. And hopefully we'll come away with ways that we can, in our own families and our own communities, address childhood obesity and make a difference. We're very fortunate, as I said, to have Kelly, Dr. Matadel with us. And her background is she's a pediatrician. She is the child health officer for the County of San Diego and plays a critical role in the planning and directing of children's health programming throughout the county. Kelly, pleasure to have you with us today.
Thank you for having me, Jonathan.
It's interesting. I enjoyed having a moment before we came on live, so to speak. One of the things I was going to share with you, and I'll share with you now, is reading the Union Tribune yesterday. In the op-ed section, which you may have been aware of, was focusing on childhood obesity. And it was talking about the effects of the pandemic. And so if you will, maybe we'll start there because that's foremost in terms of our experience, in terms of the impact of the pandemic to all of our lives, but specifically in the area of childhood obesity and health. And so I'll just open it up with letting you share what you'd like.
Yeah, sure. Thank you for that. I did see that in the Union Tribune as well. And I was glad to see it get a little bit of attention and sort of in a way where it really emphasized the fact that this is as big of a problem for our kids right now as COVID is in so many ways. And, you know, we know the pandemic affected even more people than infected. And this is one of the ways it really has affected our pediatric population is in obesity and overweight. There's been a couple of studies just recently that have come out, one through Kaiser, another that looked at a nationwide database that really showed BMI increasing at nearly twice the rate during the pandemic as it was before, which it was already on the rise previously. Especially in the younger kids, especially in that school age child where they are used to being out at recess and they're used to having PE and playing after school or on the playground before school. Even if they don't do things at home, they always had that as part of their routine, right? And that was all missing this last year. Some of them were still able to get their lunches from school, but if they were eating from home, there was less regulation on what they were eating. So kids were often left to their own devices, and we can't expect them to make healthy choices, especially if there aren't healthy choices in their house to choose. So you combine that with where kids were often just kept indoors, you know, for their safety for other reasons as well in their homes. And we saw it all collide into these really increasing numbers of even obesity more than just overweight.
Well, you raise an excellent point that during the pandemic with distant learning, there wasn't the typical oversight of how a school would provide that awareness of a child's development and what was going on with their mental, physical health during this period of time. Because typically, you know, coming to school, your teacher, other school staff would be aware if there's changes, and so much happens in a given year developmentally. And so that leads us back to, I know one of the first things you wanted to move into is speaking to those social determinants. So we were talking about home and what's available. So if you will, what would you say plays into childhood obesity related to just those social determinants?
Yeah, so much, so much. And I think this is one of the things when I was in my practice that only near the end of my clinical years did I really start to appreciate, you know, as much as I could talk to patients and maybe educate them on calorie counting or educate them on what are healthy foods or label reading. That was such a small part of what was going to really determine, you know, how they thrived in the world and even just on their weight. You know, do they have healthy air that they can get out and exercise in? Do they have a safe park or safe, you know, something more than a parking lot to play in, even if that would be safe, right? And we know that healthy food is often more expensive. You know, McDonald's has a dollar menu, but, you know, the market does not always, right? And so getting them access to fresh fruits and vegetables, a lot of the farmers markets that maybe had some of these options in the neighborhoods, they weren't as prolific during the pandemic, especially. But all of those things, are things that as physicians, we don't have a lot of control over at this point, but are really impacting and are huge barriers for our patients to achieve health.
It's interesting. As I think about, as a kid growing up, I didn't really attend to what I was eating per se. Obviously, my parents, modeled that and guided us in many ways. But recently, I came across an article that juxtaposed, let's say, back in the 60s, the quality of the food to that same quality of food, the same food today, fruits and vegetables and meats, and what you got from those, as I was growing up versus what you get from them today. And some of that is the impact on how we grow things and the environment that they're grown in, but we're not getting the same nutrients in the same way. And so I guess what that leads me to is the whole idea of how do we get basic nutritional information out to families, children, young adults.
Yeah, I think it has to be a multi-pronged approach. It can't just happen in the doctor's office. I think we've got to get some of that education back into the schools, but we need, programs like your own that have access to kids in times where they're more structured and can pay attention or are expected to pay attention to learn. And then we need to educate the parents. There's been a lot of programs as part of the Childhood Obesity Initiative looking at some of the programs that we want to sponsor as part of a grant. And I loved, these ones that were the community gardens. What a great place to teach not just the children, but the adults in the neighborhood that some of this, you don't have to rely on others for. You can help develop it yourself. And I think, that's a wonderful opportunity that, most neighborhoods could have the option for.
And that's very important. I think here at the Y, right outside my window, we created a community garden where we have fresh tomatoes, peppers, lettuce, and we started it with the children during camp. And so kids could pick fresh lettuce and make a salad and bring it home. So they're learning about that at an early age. And so when I think
and then they appreciate it more.
Exactly. Yeah, I know for me, if I had tomatoes early in life, I might like them now. But it's those kind of things that you have a different relationship at a particular point in time. So how do we go about from an early age truly helping someone to have a healthy weight? Because I look at consumerism, and as you spoke to the McDonald's menu and supersize. So how do we, in that early age, support healthy weight?
I really appreciate that you brought it to that idea of early age, because that's, I think, a lot of where especially in many cultures, the problems start, because everybody talks about that chubby baby. Oh, that baby looks healthy. Oh, look at, how chubby the cheeks are, and look at the thighs. I'm guilty of it myself, right? So that's something that we sort of have gotten into people's mind, that babies should look chubby, and the chubbier they look, the healthier they are. And there's a point at which that's not true anymore. Starting at the age of 2 is when clinically we start looking at body mass index, but we're watching growth before that. And I think it's really hard for parents to get a grasp on sort of, that early age having an impact beyond. And so if we can start with that nutrition information during pregnancy care, so that they're aware, that if they can breastfeed, that can lead to lower rates of obesity in their children later, that they don't need to be trying to overfeed their babies, that babies have those hunger cues that will, be communicated to them, and that's a really tough thing to learn, especially when generation after generation has handed these other, thoughts down to you. But I think it's a really important place to start.
That's interesting. I had never even thought of, Kelly, the whole idea of the chubby baby and how we make that an endearing quality, and just how that sets in motion certain things. Very, very interesting in that way. And I'm just going to take it. Sorry, I was trying to say one more point, because as you were saying, I kind of missed the next stage, which is the toddlers. And that's another time where there's this sort of disconnect with what's normal for the age and what a parent thinks
their child should be doing. So we have a term in pediatrics called toddler's appetite, because they just don't eat all the time. We're sort of expecting these 3 meals a day and snacks in between, and toddlers don't work like that. They eat some days and other days they just don't eat, and that's okay. If they're otherwise healthy, they're going to eat when they're hungry, and the idea is to get them those healthy foods during those days they're eating better. But sometimes they will just sort of focus on a few foods. And so parents have to adjust a little bit to that, and not worry about keeping them on that strict schedule that we've structured kind of our culture around, the 3 meals a day.
Wow,
And then they will, I always would try and warn them, they will look thinner during that time, right? Because babies do have more body fat, so they should look thinner. An average 4 or 5-year-old, their body mass index is the equivalent of an adult being underweight. So you look at that 4-year-old and you're, oh, they're skin and bones. Well, they kind of should be. They shouldn't have much body fat on them, and that's okay. And those are kind of lessons that are hard to get through.
wow, very important information for young families to have in supporting that healthy weight at an early age, and also just the habits, not having to eat those 3 meals. It's interesting. I'm aware from just preparing for our opportunity to have this conversation how if early age there isn't a healthy weight, how that sets in motion some of the health challenges throughout life, including maybe an early death because of that. So if you could speak to that, that'd be helpful.
Yeah, absolutely. I think it's important for parents and kids to understand that once the weight is there, it's harder and harder to get off. I think any adult can tell you that. It's easier to gain weight than to lose weight. And it's harder to sort of monitor and control for when you're expecting children to grow, but you don't want them gaining weight if they're already overweight. And so getting that concept through can be a little bit difficult, but what we need to let them know is these consequences on the other side. The diabetes, the achy joints from the increased weight, the heart problems that they can have when they're older. And so I try to focus a little bit more on what's now, because it's hard to think about 30, 40 years from now, right? So you can show them data about all of that, and many of the parents are already in that boat, but they think they have time. They have time to, that's not going to be a problem until later. And so just sort of getting them to, checking the cholesterol levels starting now at the age of 9, because we do see problems then, checking for fatty liver as soon as somebody's over, has reached that overweight or obesity category. Those are ways that we can start to help them see what's happening on the inside.
Excellent. So I'm going to take you kind of to where your role is now. You're in a position where you can bring about change through policy and system changes. What needs to happen on those fronts, would you say?
Oh, great question. Yeah. So, I think some of those things are starting to happen, with our Live Well initiative. We're really looking at all the different ways what we do as a county, as a local government can impact. And so having our Live Well centers, looking for ways to open up more parks and communities, helping people connect with the resources in their community. And, we, as with the YMCA, we have a lot of external partners that we're relying on to help spread those messages, and we're learning from as well. And so, one of the things I've really spent, I've been in this position a little over a year, and one of the things I've really tried to spend a lot of time is learning about the other community resources, because as a pediatrician in the community for almost 20 years, I'm shocked by the number of things that are happening that I never knew were happening, these great things that are happening in our community. And so just trying to help educate physicians that are still, that are practicing, my old colleagues, so they can start helping spread that information as well. But that's definitely been one of my goals, is to serve as that liaison to both ways, to help the community understand, what physicians are able to do and get people into healthcare, and then help the healthcare community understand all those other, folks in the community that are important towards the health of the child that are out there.
That's fantastic. So very significant work that you're doing in terms of bringing those strategic partners together. Because as you started our conversation, it needs to be this multi-pronged approach really to make this difference. What would you say in terms of supporting families and getting, whether it's family-centered communication or interventions to the families?
Yeah, so that is so important, because no child alone is going to be able to help with their, reducing their obesity. It really has to be a family effort. You know, the example I always would use was, you know, if the dad can't give up the soda, the child's never going to learn that the soda isn't the thing to drink, and it's always going to be in the house. So, and how can you expect the child not to have it, right? And so we really have to look at, you know, parents' choices and parents' habits, and then you can bring the whole family along to be healthier, which is great. So working with different organizations that are looking at the whole family, making sure to include parents in any educational efforts that are happening, whether it's happening either in the healthcare setting or the education sector or with an external partner, that really bringing the parents along to understand as well, and then understand how important it is that they're on board. But beyond the parents is so many of our families have extended families. And that gets back to those sort of ingrained cultural beliefs that can sometimes, you know, subvert the efforts of even the parents. And so really bringing any folks from the household into the picture is going to be important for the success.
Yes, a great example. I can think of you know, family gatherings, and you're wanting to be respectful of your relatives, and you have a meal, and you know, you don't want to disappoint your aunt or your grandma. Make sure you eat everything, and you know, and some of that becomes ingrained, and whether you're full. So I appreciate that comment. If I was to ask you to look at the home itself, and you spoke to the role modeling that's going on there. If you were to give me, you know, where do we start as a family today? So leaving this conversation, having viewed it, what are action steps that I might be able to take in the home? And I was thinking of something, how food is often used as a coping mechanism, almost unconsciously. And so that's a modeling as well. But if I could tap your expertise, so from this conversation, what can I actualize in my own home?
Yeah, you know, I think the little blurb we had for this talk today, we're going to have talked about how there's more than calorie counting, but actually learning about what you're eating and calorie counting, and learning about ingredients, and learning how to read labels, and just starting to do that can really be an eye-opening first step. You know, even myself, you know, a few years ago, but after I was an MD, I really started to look at labels and realize that, oh, I thought granola was healthy, but oh my goodness, that's a lot of calories relative to, you know, my Cheerios. You know, just little things like that, where you're starting to look at what do you have in your cupboard, and what does it have in it, and what is an actual portion size. So, you know, all those labels are listed as a serving size, but you don't realize that if you are gonna treat yourself to some chips, for example, a serving size is 15 chips. That means you can't go sit down with the bag, right? You've got to sort of start parsing out your food. So I think that's a great first step that people can take. And then I think having that conversation in the household, right? So need to get it out on the table. What is our goal? What is our objective? And how are we going to do this together? What are our triggers to eating? Is it emotional? Are we using it as a reward or as a punishment? And how can we change those things that we're doing that might be leading to those habits that are not going to lead to health down the road?
That's wonderful information. I like having fresh granola and berries for breakfast. Really enjoy it. And I always thought homemade granola is probably healthy, would be my bias. But I know there's probably a fair amount of sugar in it because I like it a lot. And so I need to kind of look at some of that information and just not go by, well, it's fresh, it's granola, it's healthy. So to your point of really knowing what you're eating, looking at the labels, calorie counting, portion, very, very helpful.
And there's actually some great apps that can help with that. You know, I'll just throw that out there. You know, most people do have a smartphone these days. Not everybody, but a lot of people do. There's tons of free apps that can really help to educate you, even if the food doesn't have a label. You can still kind of put it into these apps, and it'll give you an estimate of calories and content.
And I was just thinking, you know, what resources that you may point us to. I know Live Well must have some resources related to healthy eating. Any particular resources? I know the web is Google, Siri, phenomenal resources available. But if you would point to any particular that you rely on.
Yeah, I really love the American Academy of Pediatrics page, healthychildrens.org. I think that has some fabulous information that's really parent friendly, and is really kind of breaks it down into actionable things that folks can do. Bright Futures also is another thing folks can Google, and sort of talks about developmental stuff, but includes nutritional kind of by age, what people need to be looking at. So I really like both of those websites and content.
Dr. Mondadel, it's been a pleasure having you on. Anything that you want to share with us in closing? I really appreciate all the expertise that you've offered.
I would just say, you know, to go slow and kind of set achievable goals so that folks don't feel like they're not making it, right? Because then we sort of start to give up. And so I think everybody just needs to start where they're at and set these sort of small actionable goals so that they can feel a little success. And then that helps you motivate for the next steps.
Great point, great guidance, wonderful expertise. Thank you for the important work that you're doing throughout the county. Pleasure to have you on today. So thank you very much.
Thank you.
And to everyone else, please be well until we join again.